Good afternoon. Hello. Good afternoon, and welcome to the third roundtable of the Gender Evaluation and Empowerment series. This is a series of events that was initiated by UN Women, the community of evaluators, and the CLEAR South Asia Regional Center, which is hosted by JPAL South Asia at IFMR. And for our first roundtable in Mumbai, we are very grateful to partner with DASRA. So CLEAR is an initiative started by the World Bank's Independent Evaluation Group to strengthen monitoring and evaluation throughout the world. Through the M&E Roundtable series, we highlight good practices in monitoring and evaluation, as well as attempt to address the practical challenges of conducting rigorous research and evaluation in the South Asian context. The overall idea to focus on gender and evaluation stemmed from several conversations with partners that we often do not have a common venue to discuss the realities of gender research, particularly when it comes to measuring empowerment and other gender well-being measures. Gender research in itself is often very challenging, as approaches can vary various disciplines and organizations. Thus, we often have difficulty finding common language to define and research gender issues. Throughout discussions with our partners, we have decided to focus our third roundtable session on violence against women, as this is an important topic often neglected in mainstream evaluation research. We are happy to have a panel of distinguished speakers with a breadth of experience who will each highlight some of the challenges of studying these issues in South Asia. After each session, we will have a short Q&A session on the individual presentations, and we'll then open up to a more general discussion after our remarks with our panel discussant, Dr. Sonal Zaveri. Additionally, one other reminder, as you will see in your packets that there is a feedback form, so please fill out that feedback form before leaving, either to myself or to one of my colleagues in the back. And with that, I would like to introduce our MC for the event, Shayla Sacharya, who is Marketing Manager for Community of Evaluators. Thank you.
Thanks, Urmi. Good afternoon, everyone, and all those who are joining us virtually. To begin our event today, I would like to introduce our presenters for the day. The first presentation will be given by Srijana Dixon and Anju Pandey Dubey from UN Women. Introducing Srijana Dixon, she is the Program Assistant for UN Women. She is a social researcher with specialization in applied qualitative social research, social communications, consumer behavior and psychology, and intercultural relations and sensitization. Srijana has worked with diverse stakeholders, including the government, multilateral and bilateral agencies, and grassroots organizations. Anju Pandey Dubey is a specialist at UN Women for ending violence against women. She also is the program manager for anti-human trafficking in UN Women. Please.
Good afternoon, I'm Anju, and we've had a last-minute change, so we were quickly scribbling my name on this, and the other side, of course, is Tracy, so we are all from the same team at UN Women. Absolutely are privileged to be here. Shailesh said we have 35 minutes, and at the end of 30 minutes, he's going to be doing that for us, but we thought that maybe we'll try and do the presentation in 25 minutes and then keep about 10 minutes, not so much for, I'm sort of not really looking at this as a Q&A, but more as a conversation, because this is a collective learning for all of us. Therefore, for our presentation, I thought that briefly, I would just quickly step us through the anti-trafficking program of UN Women that we are sharing as one of the examples, if I may want to use that word. But and then I would invite our colleague Srijana, who was also part of the evaluation team, to specifically step us through the details of what we have experienced as part of this evaluation. When I was hearing Urvi, she talked about the challenges of measurability of women's empowerment, and in the trafficking program, that's doubly so, because we were looking at vulnerability. So I thought that I will very briefly and very quickly step us through the program so that, we have a sense of what we're looking at in terms of the evaluation. So we're hoping that the presentation, of course, will have the background, the methodology. We are already done with the baseline and the midterm review, the findings and the lessons learned. I think this is a room of experts and people, who I'm assuming are already informed on issues of violence against women. So I really don't necessarily want to step you through the data on trafficking. And if everybody's okay, I could do a mix of Hindi and English, or if everyone wants it only English, I could do just that. A quick call on that. Do you want me to just speak in English, or do you want me to do a mix of Hindi and English? That's not that difficult a question, so sorry. A mix would cover everyone, great. So, like I said that, I'm assuming that everybody's informed on this huge challenge that we have of trafficking. It's the second largest in terms of, if you're really looking at the profits that come from quote unquote a trade after drug trafficking, human trafficking is this, after the arms deal, human trafficking is the second most profitable quote unquote trade in this world. There is enough that you will find in terms of numbers. The numbers are, just because of the clandestine nature of trafficking, numbers are impossible to estimate. So even the best estimates, I think, is a challenge, because you really don't know. You may begin with migration and you may end up getting trafficked. Most importantly, I think for us, the UN talk, the UN definition of trafficking is really all-encompassing, very comprehensive definition. And for us at UN Women, we're looking at that definition of trafficking. And I'm not really going to be reading, the recruitment, transportation, transfer, harbor, receipt of persons. It's really comprehensive. The big picture, we have 1 million women and children in sex trade, and we're talking only about India. 200 girls or women enter sex trade every day. 80% of them are trafficked. I want to quickly add that, we're looking right now just at sexual exploitation and trafficking for commercial sexual exploitation, but then of course we all know that there are many different forms of trafficking, So we know that girls and young children and women are trafficked for domestic labor. They're also trafficked for, as quote-unquote bonded labor, and there are many different forms of trafficking that exist. Small children are trafficked to the Gulf countries, even for things like camel jockeying, organ trade. So all of that, I'm sure that the group is conversant with. I thought that, it might be sort of assuming that we already have some information on trafficking. I thought maybe we could, looking at the fact that we have a defined time, straight away jump into the program that UN Women is implementing. As UNIFEM, UN Women was working on the issue of trafficking from 2000. So it's not something very recent that we've started, but we had programs starting in 2001 that went on until 2009. And in 2009, there was an extensive external evaluation of the program that made recommendations. And based on that, the current program that we will be sharing was designed. So our current program actually has kind of two pillars, very simply it talks about state accountability, and then it talks about community action. But the whole focus of the program is on prevention. As you would know, all of us who are practitioners from ending violence against women/girls, we could either be working on prevention or response to violence. And this particular program actually focuses on prevention, which was also a recommendation that came from the evaluation of 2009. Which meant that that it's said that we go back to the source areas, because if you look at the whole, the continuum of trafficking, you have the source area, you have the transit and the destination. So this program very clearly focuses on prevention of trafficking. And when I say that, there is absolute clarity in our heads that we are not saying that the response side is not critical. That's equally important because it's one continuum. But this particular program is looking at prevention. And as I quickly talk about what we are doing in the program, I thought I would be happy to even flag some of the challenges that we experience. And I'm not going to talk about implementation of the program, but in the context of the evaluation. And so one of the things that I thought would be important is to flag this whole issue of how do you measure vulnerability, and I will come to that in a moment. So very clearly, since the strategic objectives are that we are talking about community action, therefore support processes that stir communities to be vigilant, because you're looking at prevention of trafficking. Creating sustainable livelihoods, that's very simple because poverty is a big reason why people are trafficked. Building capacities of local governance institutions, promoting convergence of the programs, because that's the buzzword, but again, I'm sure that it will be interesting to hear from you, your experiences, your questions on this whole convergence and prevention of trafficking and reduction in vulnerability. And of course, another element of the program is working with the justice systems and under the Nyayalaya bill. And again, in a moment, I will come to this, that, the challenges why in some states we were able to do, but in others we weren't. I'm not going to really go through these objectives. I'm sure that if the presentation will be shared with you all, you can sort of look at the specific objectives, which is actually spelling out each of what the two larger strategic objectives that I just shared, which is women and girls' vulnerability to trafficking gets reduced, and capacities of local governance and justice systems are enhanced for prevention of trafficking. The project is being implemented in 6 states in India, and the identification of the program areas was also based on a vulnerability mapping that we did in 2010. And on a scale of 9 indices, areas across India were identified, and that was all based on secondary data analysis and validation and specific, proposed program sites. The strategy for the program very clearly is looking at 3 levels, and I'm sure most of us who are working with the civil society organizations or are familiar with implementation of programs would see this kind of a strategy across programs, especially the ones that focus on ending violence against women, because you work at the individual level, you work at the level of the community, and then of course we are working with the institutions. Andhra Pradesh, Bihar, Jharkhand, West Bengal, Orissa, and Rajasthan. Those are the 6 states that we have, and it's a pilot program. Essentially looking at what could be models that we could create on prevention of trafficking in these 6 panchayats. Individual level, very clearly looking at building capacities of vulnerable populations, but particularly on assessing your own vulnerability, because, most often, quote unquote, the victims of trafficking may not themselves be aware of their vulnerability, so really building capacities on that, creating tie-ups with institutions, and as we discuss, I could share examples, and of course training on legal awareness and the justice systems. At the community level, we are working with the neighborhoods, with the community groups, especially religious leaders, not in all program sites, but particularly in Bihar. Engaging with the local experts, again, it's all very multi-sectoral, that's the buzzword, with other NGO partners and women's groups. In fact, in Bihar, we've just developed a model multi-sectoral plan with the different stakeholders on preventing trafficking, and that's the one that we will be advocating with the government of India for scaling up and for adoption. And then, of course, at the institutional level, the participation at the level of the national, the state, the district, and the panchayat. Tie-ups with vocational and other training institutes, including agricultural universities, with justice bodies at different levels, the PRIs, and whoever other relevant stakeholders. I just want to quickly share with you here that, the program focuses on what we are calling creating a center of action at the level of the panchayat. And that center of action actually is the locus for the multi-sectoral convergence of all line departments really at the grassroots level. Those are the stakeholders, are the civil society partners. We are working with AID, Jan Jagran, AID India in Andhra Pradesh, Jan Jagran Sansthan in Bihar, FXB Suraksha in Jharkhand, CBATN is implementing in Orissa, Seco-Dicon in Rajasthan, and Sanlap is the organization that's working in West Bengal. Local governance institutions, the partnership is with the panchayats, and that's where, again, we could look at what are the different models that we're looking at and how do you assess and evaluate, and when we look specifically go into the discussion on the evaluations. The justice systems is a bit tricky, especially the JGBs and the police authorities and the CWC, that's fine, but really engaging the institutions under the Nyayalaya bill, that's been quite a challenge for us. We also have partnerships with the self-help groups because we are talking about reduction in trafficking, therefore looking at livelihood opportunities. And that's also been one of the biggest challenges for us because, a program that is focusing on prevention of trafficking cannot really claim to be an anti-poverty program. And, we've had some really interesting discussions at the time of our baseline that I'm sure Srijna will share with us. So really in terms of, defining what our boundaries would be for a program that's talking about reduction in vulnerabilities. We've constituted 40 anti-trafficking vigilance committees, peer educators. Communication Hub has done this very interesting film, which is going to be used as a medium for awareness generation, etc. So largely, we're looking at then the vulnerable population of women and girls, and UN Women working with its many different partners. Some of the highlights that we thought would be interesting for this discussion today is that the whole program actually originated out of this evaluation. So it's not something that's just come up. There has been a history to it. Specific recommendations were made that led to a focus on prevention. The vulnerability mapping bit is very interesting. Again, we sort of dealt with all those challenges on defining and really defining the boundaries of vulnerability. It focuses on source areas, therefore I've already talked about that, prevention in addition to protection, quote unquote, capacity building of all the different stakeholders, income generating activities, use of media and documentation, and of course, rigorous monitoring and evaluation that's been part of the program. At this point, I'd be very happy to invite Srijna to share with you the evaluation methodology, and we have in the group our colleagues Shresi, Rajat, and Elora from UN Women, and Shresi, maybe, as and when required, you guys can just pitch in. Yeah, thank you.
Thank you, Anju, for taking us through the program. Coming to the evaluation methodology, the program started in 2011, And so I said 2009 because that's when, like the vulnerability mapping and other studies were done, and the program was a result of the vulnerability mapping. So the program started in 2011, and we are in the 3rd year of the program now. And about monitoring and evaluation, I want to say that evaluating this project, we were looking into assessing, the outcomes and goals of the program. And monitoring is critical to evaluation because an assessment of inputs, activities, and outputs was critical to understanding and assessing, the evaluation at the bigger level. So what are the outcomes and what are the goals, and assessing them. So, and we conducted the baseline was done in 2011, so that's when the project started. And I will run us through the methodology for the baseline. The midterm was done 9 months, 10 months, after the baseline. And so we are through with the midterm and the baseline. And the project concludes in June or July this year. And we are looking at, the end term evaluation now in just, next month or another month from now. The kind of evaluation dimensions that defined this particular, evaluation for this particular program were, quantitative and qualitative analysis and methodology. Anju took us through, the stakeholder groups, so multi-stakeholder involvement, participatory and consultative, consultation, of the stakeholders. And so about the methodology, Anju talked about it. So we are covering 6 states and 1 panchayat within each state. Extensive literature review was carried out to develop an evaluation framework, which then led to primary data recording for the indicators that were identified. And we used like a sample of village households. A mix of methodology, quantitative and qualitative, were used. Now, at this point, it's critical that the theory of change was used as a foundation, to program, to defining and identifying in the first place program inputs, activities, and envisaged outputs and outcomes of the project. So the baseline, the results of the baseline fed into the theory of change. And in the midterm review, what we did was the indicators that were identified during the baseline were assessed, which resulted in measurement of change in the midterm review. We made use of the evaluation analysis based on DAC criteria, OECD's DAC criteria for evaluating development assistance. Now this involves evaluating a program, across relevance, effectiveness, efficiency, results, and sustainability. Now, the evaluation criteria from the DEC led to identifying and defining, a list of indicators. And the indicators then led to definition of defining, the indicative themes. So I'm just going to pick, 2 evaluation criteria to take us, through the process. So for relevance, which essentially meant that we were identifying, the extent to which activities defined in the project suited, to priorities and defining the project goals. The indicators were, priorities and needs of each panchayat. So this was identified during the baseline, and expectations of stakeholders. So what were the expectations? The indicative themes that led to were, you know, like first-hand account of gender, dimensions, and norms. And these are just some of the themes. Vulnerability assessment and existing interventions, challenges, and opportunities. Now, about the sampling, we used a quasi-experimental design, which essentially means that that a target sample was drawn, and subsequently a smaller comparison sample was drawn. For the target sample, we used, you know, like a 95% confidence level, while maintaining a 7.5% confidence interval, which essentially means that the margin of error was 7.5% for the target sample. And based on that, the comparison sample, the confidence interval was 12.5%, because comparison sample is always smaller than a target sample. I'll just take us through drawing the sample for the state of Bihar. So the total number of households in the Wazirganj block were about 26,500, and the number of villages were 138. The average number of households calculated was 192, and number of villages selected, you know, in that particular panchayat were 11. So we came up with the total number of households, an average number of households, which is 2,110, and using, you know, the confidence interval and the margin of error, at 7.5%, our sample was 158 for the target sample, whereas for the control or the comparison sample, it was 92. So if we look at the total sample size for the baseline, our target sample was 910, whereas the control sample was 310. Then we also went about drawing a 20% of the target sample, wherein this sample was administered in-depth interviews. These were structured in-depth interviews. And the target and control sample were both administered household surveys. These were structured household surveys. And then some of the stakeholders, justice bodies and NGOs, police, they were administered semi-structured interviews to get a holistic understanding and to get a holistic round of information for the project. So that's about the sample size. The data collection tools that we used, it was a mix of quantitative and qualitative. So I already talked about it. There were semi-structured interviews and household surveys. And for the midterm review, we again used semi-structured interviews with our stakeholders as well as group discussions. The areas of change, now this slide talks about the change, the measurement of change, you know, from baseline to midterm, and of course, you know, like to the end term. So with respect to households and families, you know, we are measuring, you know, awareness of risk factors, which means that, you know, we collected information from the target sample, and now going back to the end line, we will be comparing, you know, the results based on the areas of change that we have identified. So for example, for community decision makers and PRI representatives, you know, what are the existing gender norms, awareness on trafficking issues and attitudes, so on and so forth. These are some of the examples of monitoring indicators. So Anju told us that we have two outcomes. There are two broad level outcomes for the program, and each outcome is classified into a number of outputs. For each output, we came up with a set of indicators. So if I'm just to talk about output 1, enhancing awareness of community members, some of the indicators are, you know, number of peer educators that were identified and recruited into the program. Now, these peer educators also are also very vital stakeholder groups in the program. So there are a number of indicators for each output. I'll be sharing some of the key findings. Anju did, run us through it. So some of the key findings from the baseline, from both control as well as the target sample were that, women migrate from their homes primarily for two reasons, employment or marriage. This was a trend seen across the 6 panchayats and the states. If we had to take examples, so in Andhra Pradesh and Bihar, for example, and West Bengal, more women had migrated to seek employment, whereas in Jharkhand and Orissa, most women had moved out of their village after marriage. So the trends were really different. Some of the common risks reported by respondents were long working hours, sexual exploitation, physical abuse, and no provision for childcare or education. Cases of missing people were reported, by the respondents in Bihar, Jharkhand, Odisha. To take an example, like 40% of our respondents from target group recall cases of missing people. Also, women's participation in local governance is extremely limited. So based on, these were some of the findings, and based on the findings, the program had a set of indicators and activities. The only platforms available for women for shared learning were SHGs. So these are some of the findings. Now talking about the midterm, like 10 months into the program has achieved or organized, I would say, like about 880 meetings sensitizing women and girls, and in fact all community members, including men, on trafficking and violence against women. So these are, some of the findings from the midterm. And 140 SHGs have been identified by implementing partners across, the 6 states. Anju talked about anti-trafficking vigilance committees, which is one of the activities from the program. So about 40 such committees have already been set up. Some of the lessons learned, and these are just a few, is that, trafficking, we know that it's a crime under the Constitution of India. So when we developed the tools and the guides for interviews and surveys, we realized that it is difficult to elicit specific information. So for example, conducting the semi-structured interviews, we got more qualitative information from both the community respondents and local governance. And I want to talk about, the specific case of Rajasthan here. So out of the 6 states, in Rajasthan, we are working with a community called the Nut community. And the context of the population in Rajasthan in this community is markedly different from the rest of the states. Because this community kind of, I won't use the word encourage, but prostitution and, if I may use the word, and sex workers the community is kind of, I won't even say open-minded, but the families kind of encourage their girls and women to go out of the community and work as sex workers. So the kind of challenges that we faced in this community were markedly different from the rest. Next is, the administrative setup of the project areas in the states of West Bengal and Andhra Pradesh was again different. It was not possible to select a sample on the basis of the number of villages here. On the basis of the number of villages here, I'm actually running short of time. There are some lessons learned, if I'll just quickly run us through it. We were talking about converging the stakeholders. So one of the few learning practices that came across were our work with the special, I work with, I can't, yeah, the SI, State Institute for Rural Development. I would just conclude here because we are running short of time, but this presentation is with you. Thank you.
one of the things that, very quickly, and then we can have questions. I just wanted to very quickly qualify and actually add the example that Srichna picked up from Rajasthan. So in each of the states, we're looking at, different elements. So for example, West Bengal, we found that the trafficking was largely through this whole route of child marriage. In Jharkhand, this is, very obvious trafficking for working as, house helps in Delhi. In, again, Jharkhand, it's the tribal population that we're working with. In Rajasthan, the Nut community, it's a very curious and interesting case, because in Rajasthan, the Nut community, just like the Bediyas in Madhya Pradesh, traditionally dedicate their daughters to quote-unquote sex work. And commercial sexual exploitation and versus sex work is a much larger debate. I don't think we have the time for that, but maybe in another forum. But in Rajasthan, it's kind of a bit twisted, because it's this dedication to sex work where women from that community and young girls were actually earlier coming to Mumbai to the dance bars, and once that was shut down, they went back to the village and then were actually trafficked. So, it's an interesting case where it's not trafficking that is resulting into commercial sexual exploitation, but it's the other way, that because there is a cultural practice of dedicating daughters to, quote-unquote sex work, that results in their trafficking. And then we'll be happy to have questions from you, or, your own learnings, sharing on evaluating or implementing similar programs.
Hello. Hello. Yeah, my name is Devashish. My name is Devashish. I work for IWPRO Impact Solutions. We have been involved in numerous evaluation and baseline studies. So just one technical question. Can you just go back to the indicator slide?
Sure.
Yeah, thank you. Yeah, the same one.
I'll just go next quickly.
Yeah, this one.
Yeah.
Just trying to understand the indicators that were set for every output. So in the first example, we are seeing that enhanced awareness levels. Okay, this is the point we are talking about, and the only thing we are discussing about in case of indicators are the numbers of peers, educators, capacity building training imparted, and this thing. So are we not trying to measure anything which is very direct towards increase of awareness level, or it's only the number of activities which we are doing?
Hello, my name is Amita, and I was just curious to know about, since this program began based on the evaluation, so it's been almost 3 years that you began the program, so whether you have seen any changes in the decision making and the whole power dynamics of the women, scenario of women in the villages, because you also have economics going along with that, you have SSGs and savings and income generation going along with that. So just was curious to know whether you have seen any changes with that.
Q&A in the end. My name is Sandhya, and I was curious as to what statistical tools you propose to use to measure change between baseline and midline.
Good afternoon. My name is Shreyasi Jha. I'm the Monitoring and Evaluation Specialist with UN Women. So I'm going to take two of the questions that you asked about evaluation. So before I answer your question, I would like to just qualify the approach that we took. I think, typically what we found at the time that we were developing the evaluation methodology for this program is that this was a very, it's what Anju was referring to. Measuring vulnerability was a very nebulous concept. We were trying to get our hands around how would we measure it. And so your question about, how did we measure change, is actually right on target. You know, we were really struggling with how do we go around doing it. But the program, the way it was designed, and I think the part of the reason why the program was designed in this particular way is because it was based on the previous evaluation. It provided us with an opportunity because we're implementing it in such a focused area, the geographical area of implementation for the grassroots level work, where I would say more than 60% of our project, if I'm correct, Anju, implementation is happening at the grassroots level, really focusing on only 6 panchayats. And for people who are working in the field, you know how limited the intervention is going. And that provided us with a very good opportunity to have an evaluation that allows for this kind of pre and post comparison. So because of the nature of the implementation, we made sure that before we started the program, we had data on precisely the kind of question that you're raising, awareness level. We could not, what Srijna also mentioned, experiences during the evaluation, we could not directly ask questions about, so how many girls have been trafficked from this village? We could not ask those questions. If you look at the survey tools, we had to be very careful about wording the questions in such a way that we were trying to get to the point about trafficking in a very roundabout way. And that was some of the experiences that were shared by the evaluation team, is that, it is very difficult for us to actually get a number on how many girls have gone for work and how many girls have been trafficked, how many girls have gone voluntarily versus how many girls have gone, as a result of marriage, which could be anything. We don't know. So these were all the challenges that we faced. But just coming specifically to the question about, how do we measure change, we do have baseline data and very, very detailed data, because we have a whole set of questions that we'd asked about trying to indirectly come to this point about what is the awareness of some of the challenges that are involved when people are migrating outside. And really in a roundabout way coming to this thing about, what information would they like, what is needed, because that helped us in designing the implementation. But we do have data on that, and the final evaluation is starting now, probably in June, and we're going to collect data once again on the same set of questions. And because of this very, limited limited intervention in these 11 villages in Bihar, it allows us for that comparison. So we hope we'll have more interesting results to share. Your question about the indicator is very well taken. These were not meant to be change indicators that we were measuring. These were more indicators that were activity level tracking that we were doing. So our partners were expected to report every quarter on these indicators. So these were more activity level indicators. We have different indicators for the impact level, which we're only collecting data at 2 time points, which is at the baseline, and now we'll collect that at the final level. Anju, do you want?
I can speak from here, Shresi. I actually just want to quickly add to what Shresi is saying. So, for us, even, I think sometimes when we're looking at programs that we're implementing on ending violence against women, even the word trafficking, तो प्रोजेक्ट एरियाज में क्या हो रहा था कि ट्रैफिकिंग शब्द का इस्तेमाल नहीं हो रहा है, लेकिन जो प्रक्रिया है ट्रैफिकिंग की वो तो हो रही है. सो दैट होल प्रोसेस इज देयर, बट even that was a challenge in terms of, like Shresi rightly said, that if we go to the community, how do you ask that question कि क्या यहाँ से लड़कियों की ट्रैफिकिंग हो रही है? तो झारखंड में जैसे वो अपसारण शब्द इस्तेमाल करते हैं, बट अपसारण is kind of sitting somewhere in between voluntarily migrating and then landing up in some brothel in Delhi, literally, So even that was a challenge. But, just to answer your question, sir, we do, in the program, at least from the monitoring perspective, we're also looking at, not just this quantitative numbers of 81 peer educators, but also the fact that कि उस इलाके में पहले बिल्कुल भी अवेयरनेस ही नहीं है. मुझे पता ही नहीं है कि मेरी ट्रैफिकिंग हो गई है, मुझे पता ही नहीं है कि मेरी बच्ची जो यहाँ से गई है उसकी ट्रैफिकिंग हो गई है, क्योंकि मैं उसे ट्रैफिकिंग की तरह नहीं देख रही हूँ. मुझ में वो अभी मुझे वो समझ नहीं है या वो awareness नहीं है. But even identification of these 81 peer educators who are now informed and understand trafficking as we understand in the first or the second slide of the presentation, which is an internationally accepted definition of trafficking. So your point, very well taken. But I think more from not really as an indicator, but in our own quarterly, monthly monitoring, we are trying to capture those changes through the case studies. Yeah. And which would also be true for, someone, you asked a question on changes in decision making. And I think we have some really good examples that are, we're trying to capture as case studies is the women's groups that have come together, understand the vulnerability and how they have taken action to really prevent and support and, again, we don't know how we're going to measure it, but at least even if I think there are anecdotal examples of stopping the trafficking. And the fact that, we have to be so careful when we are working with the governance institutions, because हम लोग ये नहीं चाहते हैं कि trafficking के नाम पे फिर आप लोगों के बाहर जाने पे ही रोक लगा दें, because, as you could be free to go anywhere in the country. So, even that challenge of working and trying to sort of see that doesn't happen, because we do have the vigilance committees maintaining records of people's movement, but then that record cannot be an end in itself in trying to really limit anyone from going outside of the village. Yeah.
Can we have a detailed question and answer session at the end? Okay.
Actually, my question is about because the violence against women issue is also connected with the public health, the mental health, as well as the reproductive health impact. So while visiting on the indicators, although it's not visible, have you come across any such kind of thing which has really had an effect on the health, especially the reproductive health and the mental health issues?
I think that's such an interesting question that you're raising. I don't think in this program we were looking at it, initially when the program was designed. And I'm so happy that you've raised this whole issue of public health, because not in this, but in a completely different program that we're implementing, and of course Priya is here, the Safe Cities one, increasingly that convergence of, public health issues and women's quote-unquote safety security, that kind of dialogue is happening between communities of practitioners, etc. But I don't think in the anti-trafficking program, although there is an awareness on the consequences on quote-unquote public health, I don't think we are tracking that in this program. Maybe moving forward, as we're looking at connecting the different dots, that would be something interesting to look at.
Thanks, Anju, Srijani, and Shresi for sharing your lessons learned from the field. We now have our next presenter for the event, Dr. Priyananda. Dr. Priyananda is the Director of the Social and Economic Development Group for the International Center for Research on Women, Asia Regional Office in New Delhi, India. In her role, she oversees research, policy, and programmatic work on issues related to gender equality and poverty reduction, with a focus on the intersections between economic and health issues. Her expertise includes research, measurement, and evaluation of women's economic empowerment and access to health services, including reproductive health and HIV. I would request Dr. Priya to...
Is it okay if I just sit here?
Yeah, it should be fine.
Is this fine?
Yeah.
Is this working?
I mean, if it's audible for the audience.
Okay, great. Good afternoon, everybody. Thank you for inviting me to this forum. I have been a previous presenter, and perhaps what I've presented before may inadvertently be overlapping by some of the things I say today, only because a lot of what we do and say is so deeply ingrained and embedded in our consciousness because we believe in what we do and what we measure. So that's why if you've heard a previous presentation, you might see some recurrence. I was actually asked, although the topic this afternoon is about measuring the impact for programs that are working to reduce or eliminate violence against women, I'm kind of taking a step back a little bit. Although we do work on gender-based violence programs, as Anju did mention, I'm kind of taking the approach of looking at something much more, not from a vulnerability or risk perspective, but from an empowerment perspective, and the focus will be on adolescent girls, only to make a case, but the case that can be made for women, men, any vulnerable populations. And the topic is really about measuring adolescent girls' empowerment. So what really is the continuum from the previous presentation is about measurement, and is about indicators, and it's about knowing what you should measure and what is the theory of change and how you expect with your intervention some change to happen, and how would you in your measurement frame track it and measure it and qualify it and quantify it and validate it and prove to the world that this change is happening. So that's really what I'm talking about. And I kind of provocatively have titled my presentation Making Lives Visible. It was basically asking ourselves that while we recognize problems, we understand them, but how much are we really making an effort to make those really visible to those for whom not having the hard data is really debilitating to make any policy decisions. Also, I'm kind of with a question mark talking about a feminist lens, because many of us who are working within the community of feminist evaluators are saying, what is a feminist lens to evaluation, and should we be using that approach? So just going to be kind of teasing you a little bit to take back some ideas about a feminist lens, and I'm sure Sonal will be talking about the same. And this is not a comprehensive 101 on any of these topics, because I only have 20 minutes. Okay. So my outline is really just first going to make a case about why we need data on measuring adolescent girls' empowerment, complexities with measurement, kind of talking a little bit of what a feminist lens would be, and then talking about a framework that we are developing with Dasra to just kind of leave you with that idea. Okay, so why is it that we want to measure adolescent girls or women's vulnerability, risk, empowerment, whichever frame you want to look at? And I think for many of my friends here who are from Delhi, from the center, from the UN, and from larger organizations, we know that for a long time one was making the case that gender equality is important. I think we no longer now need to make that case. Gender equality is finally on the world's radar screen. And what is really the problem is that well-evaluated adolescent girls or women's programs with a gender dimension are still rare. Especially in the economic sector, you will still find a fair amount of evaluations of programs on delayed marriage, delayed fertility, but really looking at, if you want to look at livelihoods, economic empowerment, even prevention of trafficking, really looking at it, this other continuum from risk and vulnerability to empowerment, the other side, you find lesser and lesser programs that are evaluated. And why do we need these evaluations? We need these evaluations even though you and I know change is happening. We need the numbers because numbers talk. After all, even in the presentation today, what we were really missing was the findings from the end line, even though they're not available right now. But what we leave back with compelling, convincing cases when we see the numbers. All of us have that predilection. And also for program implementers also, numbers are important because measures of program effectiveness are necessary conditions for really understanding how to prioritize replication and scale up of the same programs if they're found to be successful. So, and the other thing that we are hearing a lot more in this kind of new jargon or expectation is the returns on investment. So while progressive donors, and we have some here, and governments do recognize that we need to invest in girls empowerment programs. Whenever I say girls, you can replace it by women's, boys, it doesn't matter. My topic is girls, but really adolescent empowerment programs for girls and women. But what the desire is that you need data on what is the returns on investment, what is most strategic to invest in to bring about social change. So the question today is not that is it important to invest in adolescent girls program, but what within the adolescent girls program is important. Is it education which is more likely and have higher returns on investment to delay age of marriage, or is it a community-based social change program, or is it really working with parents and community members and panchayat? So what aspect of the program is much more strategic to invest in? Because resources are limited, people's time is limited. We are not going to wait for 20 years to see the social change which we want to see in an expedited basis because of the kind of problems we are facing today due to the lack of previous investments in these areas. So I just wanted to kind of give you an example of, if I think, we recently did a review of adolescent girls programs with funding from the Ford Foundation. It was very much a focus on what's happening in the adolescent girls program in the livelihood space. So what I'm presenting is a little bit from that lens. And what we found is that there's a lot of investments or previous programs globally and in India on looking at delayed fertility, delayed marriage, delayed first pregnancy, delayed first birth. And with the larger, fairly idea, it was a very much a public health disease reduction model of having healthy mothers, reduced threats, disease, reduced risk of violence, which was still very much looking at it from that epidemiological paradigm. So the kind of indicators you would then find available, where the data is available, sometimes nationally, sometimes at the district level, but definitely sometimes at the programmatic level, different indicators would be available at different levels, would be around indicators around age of marriage, age of first birth, knowledge and attitudes to family planning, use of institutions for childbirth, for pregnancy, delivery, anemia prevention knowledge, knowledge of hygiene, menstrual hygiene and disease prevention, experiences of violence. So we have data available on this. And a lot, especially around violence, it's really been 2 decades of research that we can now say we know we have data on prevalence of violence. So this data is available because of the efforts of past articulations and past work. But really, I think when we look at what is a future expectation and what future priorities would be, it's very much looking at creating capabilities. If we want to use the Amartya Sen approach or whichever lens you use, but it is about capabilities. It is about enhancing opportunities, equality and freedoms. So in this domain, the kind of data we need is still very scarce, and the examples of these data, I mean, these are not, I just want to qualify, these are domains. I haven't specified them as indicators, and I think you would understand them. These are just areas that then would become measurable indicators, but it could be aspirations for future of adolescent girls, not reduction in stigma or shame, recognition of pleasure. This is very much in the domain of working on sexuality and sexual health, ability to make healthy and safe choices, confidence, decision making, equal opportunities as boys. If you're working with boys on gender equality programs, and it's really boys respect girls and engage with them as equals, experience freedoms in private and public space. So if you look at it as a violence prevention program, this is very much about violence prevention, but what we're really talking about is, are girls now more mobile in public spaces? Are they able to go out with less threat and less risk and less vulnerability? So it's experience of freedoms. Girls' economic agency and employability, which I've kind of said came out of our review, very little work being done on that. And then economic productivity and incomes. And if you look at the gradation of these indicators, they're going very much from the attitudinal space to the behavioral space to much more hardcore, that if all of this was achieved, then in the end, you should see higher productivity and higher income. So, you will see that kind of long-term impact, but perhaps before that, there are all these intermediary outcomes that also need to be achieved. Now, who needs this data? What's interesting is, as ICRW, what we're finding is there are larger and newer constituencies for data, while previously 10 years ago or even 5 years ago, our constituencies were much more limited. They're much broader now. So the policy makers, it's not just policy makers, it's the kind of policy makers who are coming out and seeking data. Advocates and coalitions, many more organizations are working in coalitions. For example, Girls Not Bride. They have a need for data which didn't exist across organizations that worked in partnership across the globe as coalitions. Corporations in India, now there's a larger space for Indian corporations who are beginning to invest in the development sector in the development stage, somewhat tippy-toeing into it, but they're there. Implementing organizations, now these are not just large organizations, but also the grassroots feminist organizations, you know, whether it's Jagori, whether it's Kriya, all of these organizations that were working with communities, which were working on the ground, are now beginning to think about indicators, measuring their programs, looking at that impact of their own programs. New donors. Even in the last 5 years, our world of donor space has increased, enhanced to newer kind of donors with new questions, new needs, new kind of analytics, which demands, I mean, that's the whole language of return to investment, where it's becoming such a big question because more and more people are entering the donor space and asking these questions. And multi-partner commitments like the Clinton Global Initiative, for example, and media. So that's become like, earlier I think we wouldn't get so many calls and hits from the media, but now increasingly we are asked like on a spot basis to be available for an interview at BBC or report to a reporter in Times of India. I mean, there's a hunger for data, is a larger context of data needs is really expanded. So fine, so I've kind of made the case that, you know, there's need for data, there is scarcity, and the kind of data we want is different than what we had earlier. But let's then quickly look at what are the complexities in measurement. So I'm just going to talk through complexities at different levels. So if I think about it as an implementing organization, from the perspective of an implementing organization, I think the complexities in measurement might be around articulation, around what to measure. So implementers that are working on the ground often encounter transformations. They're working with girls, they're working for women, they see that their lives are changing. But then they're really what they're grappling with is how, the how and what of measurement. You can see changes happening, but you don't know how to communicate, measure it in these capsule versions that are palatable to the rest of the world. On the other side, the pressure for implementers is that more and more the resources are coming within a certain time span, like 3-year funding, 3-year optimistically, sometimes it's 1 year, sometimes it's 3. Liberally, it might be a 5-year funding cycle, but interestingly, anything less than a 3-year funding cycle with the idea, expectation that change could be measured. So while the funding cycle is short and it takes 6 months to conceptualize and start a program, and then on the other side 6 months to wrap it up, that means in 2 years you have to achieve how trafficking across 6 states in the country has reduced when the problem has persisted for centuries. So, you know, how are you going to do this in a 2-year or a 3-year capsule? And what can you realistically expect to see in 2 years, you know, rather than really be so ambitious that we want to see the change that we wanted in 10 years, but show it to us in 2 years, which clearly is not realistic. And therefore, my third point, lack of an effective theory of change that can really measure the intermediate outcomes in a specified, in that 2-year time frame, that will be a pathway to longer term change. So my question to you and women would have been, what was your expected theory of change? What did you expect to see in 3 years? And is that what you measured? And I think that's a very important reflection even for ourselves, because many of us are not being able to spend time to reflect as well. So, and the second point is around definitions. So, we want to desire to accurately measure change in girls' and women's lives, ignoring that empowerment is a continuum and does not have this inherent linearity. I mean, it's a process, it's a journey that you are embarking on, and so it's not very easy to say you've achieved it or reached it and even then, you know, measure it. And so Naila Kabir kind of talks a lot about this, and she talks about the fact that not everyone acknowledges that empowerment cannot be easily defined, let alone measured. And these are just two very contrasting definitions of empowerment that I have here, where the World Bank is looking at empowerment in terms of making markets work for women and empowering women to compete in markets. So it's a fairly clear, measurable, but kind of reductionist definition of empowerment. And Naila Kabir says it's a process by those who have been previously denied the ability to make strategic choices acquire such ability. So when she deconstructs that framework, which many of you might have read, it's about agency, it's about resources, it's about achievement, and then there are many, many complexities around each of those domains. So then bringing that whole idea of empowerment, that we are really talking, even in the trafficking example, if you were to empower women and communities to say no, you would be able to prevent trafficking. So what is empowerment? Like, how would you really measure it? The fact is, it is a multidimensional concept which is context specific, because as Anju talked about in the end, that each of those states had a very different nature of trafficking that was happening. So that's the context. It's very context specific, and it varies by perspective, by timing, and actually, it's not very different from measurement of poverty. When we talk about poverty line, we have all of the same considerations that we talk about when we talk about empowerment. And so the challenge is to design non-binary kind of measures that capture girls' experiences of change, which may go in positive or negative direction. So because it's not linear, because it's not all happening in one direction, there may be some things that will improve and some things that will become worse. And therefore, recognition, when we are doing work on empowerment, recognition that even the presence of conflict means that you're challenging the status quo, and that is not a program failure. It doesn't all have to go in the positive direction. So previous work that I have done for my dissertation on microcredit programs and a lot of work that happened in Bangladesh, initially when women started to take loans and getting economically empowered, violence against women was shown to increase. So this is like both positive and negative, and therefore it isn't linear and it isn't binary, and I think it's very important to recognize that when we talk about empowerment. Indicators per se, I think a gentleman from the audience talked about indicators. It is very difficult to develop indicators for your program. I think it could take a good 6 to 8 months really to think through the complexities of what you're doing, why you're doing it. And then, of course, the fact is the issue of time frame that I already talked about, standardization. If I'm measuring effectiveness or efficiency or productivity, I have to define it in the same way in every context that I'm measuring, and what would that definition be and how will it be context specific and be comparable. And then all of that basically leading to measuring impact, and that has to have a value for donors and for people who are investing in these programs. So indicators become very important, the development of indicators, good indicators, and at the same time fairly complex. I think that basically the other aspect of measurement is frameworks. So I'm just going to talk about this very quickly. A lot of us are, when we are measuring impact, we kind of fall into this trap. It's not a trap, it's important, is to look at causality. But the fact is there's causality and causal frameworks, but there's also contribution. So if you really don't have the methodology and the design in a very rigorous way to measure causality, but you can look at contribution, then why sometimes you find that programs are force-fitting themselves into measuring causality when really they perhaps should be only talking about contribution. But then there are gender analysis frameworks which are less understood, which really kind of bring both those two frameworks together. But then the issue is most frameworks are again bound by these 3-year grants where little can be assessed in terms of changing gender relations. So I think if you're really using causality frameworks with an impact to measure things like, reducing violence, I mean, I think it's very difficult to say that you've done that, because certain forms of violence may be substituted for other forms of violence, and so you haven't per se in a composite way addressed necessarily reduced violence. And lastly, in the idea, I mean, I just kind of put that there because for me, and even working for the last 7 years at ICRW, I've been thinking how little time one gets to be reflexive, to really think about one's own assumptions. How did we measure? What did we think would happen? Were we right? How could we improve this later? So just that idea of, again, that's yet another complexity in measurement, is to giving us time to learn from what we did previously and apply it in the next round. So, sorry. So now I'll just very briefly talk about what I am learning about feminist principles, and I'm not an authority. It's very recent reflections that we're saying, some of us are benefiting from a group of a community that's congregating around these issues. And I think some of the things that I have taken away and kind of tried to apply it to our own work at ICRW is really saying that whether a program is working or whether it's meeting its objective means that we have to define what working really means, looks like. What does it mean to say a program is working? And then who decides what success looks like? Is it we as evaluators, implementers, the community, donors? I mean, who decides what success looks like? And are there different and competing definitions of that? So what might be success for a donor might not be success for a researcher or evaluator, might not be success for the women themselves. And then basically really to understand which community or which groups of stakeholder then define success, and are they the ones who have more power and stakes in the overall evaluations. And then secondly, the point that has come up previously in my presentation, that change is not linear or always increasing or systematic. So I think a good feminist lens would use that idea a lot more even at the outset when we are developing our evaluations. And the fact that empowerment may be met with resistance and change could get worse before it gets better. So again, I think your evaluation lens, your measurement frame would allow you to develop and capture indicators which go in both directions, or allow you to look at least two-way shifts. So for example, a recent study that I am doing in Haryana, where we are finding many more girls are going to school. So that's like a positive indicator. Girls' educational attainment is increasing. But it might be that I missed how many minutes that was. You moved away too fast. 5. Okay. But it might be that their mobility is getting restricted. They have to go to school and they have to come back because the overall social environment is deteriorating. So on one hand, mobility is getting restrained. On the other hand, educational attainment is improving. So which indicator are you going to look at? What is your metrics? And then who decides which one is more important than the other? And also need to measure as close as possible to reality and not to assumptions. I think that's a self-evident point. I think the other thing is to really, again, the conceptual analytics, like when we are developing our theory of change, when we are really thinking about measurement, really understanding these diverse pathways of change, and then understanding what's important to measure. And then in that, if that is the frame you're using, if you're not using causal frameworks, if you're using contribution frameworks or gender analysis frameworks, then at least minimally to kind of be very confident about the methodological rigor in what you measure. I think it's not only that it is true that there is a larger articulation of gold standards evaluations, but even in more qualitative research, in mixed method research, there are rigorous standards of that of methodology, and so to kind of recognize that. And just I think this quote I really like. Oh, I'm sorry, I have stopped moving on this. To really, I mean, I think this quote really captures this whole idea of complexities, is that mainstream empowerment narratives tend to neglect relationships, focusing on individual women's trajectories of self-improvement or on the bigger picture of society-wide economic change. But women's lived experiences of empowerment cannot be understood adequately by approaches that atomize women, abstracting them from the social and intimate relations that constrain and make possible their empowerment or disempowerment. So I think this really is really capturing the complexities of what we are trying to measure, and sometimes how much we have to prove and validate to the world about what our analytics is and what our measurement is, when we know how complex our measurement frames are. I apologize about this, I'm doing both things. I think one of the recent experiences also, once you measure, is also then validating what you've measured. And you know, the first bullet here is really coming from my experience of working on a women's economic empowerment program, where we had data of a program, data from women talking about how they're being more productive and how they're producing better quality work. It was in the context of work, a program for women in the garment factories. And when we presented this data for the first time and the second time, what we heard back from inside the community, this is not even going outside, was this is women's self-reported data. So, you know, that really made me think that that is, sometimes it's questioned, that self-reported data, and therefore may not be considered as reliable. But luckily for us, we had really, for us, our methodological rigor really came from multiple points of view. So we had different stakeholders commenting on the same indicators, measuring the indicator from different sources and multiple sites of examination. So we didn't just do it in one factory at one point of time, but we repeated the measurement at different sites and at different points of time. And so really the credibility of what we measured, so it's like validity versus credibility in a way, was a prolonged engagement in the field and the persistent observation and triangulation of data. So I think for me that's also a very important point of methodological rigor. But at the end, you know, for many stakeholders, we need the hard data. We need, if I want to say that women are more productive, then I want, somebody should be able to say, oh, so the profits are higher or the losses are lower. So that's the hard data in comparison to women's self-reported data, that we just feel better doing what we do. So ultimately, you still sometimes need the hard data to provide testimony around how women's and girls', you know, lived reality has been positively transformed. So while I've been making the case that sometimes it's very difficult and complex to do these measurements, and some of the ways in which you measure might come from mixed methods and qualitative observations, but I think the marriage of the two is very important, blending some of the hard data, and I don't like to call the other soft data, but the not hard data is also very critical. So then I'm just going to end in the last 3 minutes with the work we are now beginning to do on developing a framework for measuring adolescent girls' empowerment. I hope I have convinced all of you that it's very important to measure and it's complex. And the fact is, now we are trying to do this in our case in here in India. I think the point I wanted to start with was the current frameworks. We've just begun to do a desk review, but we found that very few frameworks actually exist on measuring women's adolescent girls' empowerment that are also comprehensive. So they're not just looking at one domain or the other. And what's interesting observation is that they often focus on vulnerability and risk reduction and not empowerment. And also, we are not getting a sense that if we are talking about girls, girls is not a homogeneous group. So like recognizing the heterogeneity and not necessarily giving us an indication about what are the marginalized girls and most vulnerable populations share of the existing donor resources or program resources. And they've not been used or applied by adolescent girls programs in India, these frameworks that I think we reviewed, which were much more global. So our approach is to basically develop a conceptual framework to understand adolescent girls' empowerment, identify a set of indicators that can be used by a range of implementing partners. They should be inclusive indicators that do not ignore the most marginalized, develop a common tool for measurement that can be used by different types of organizations, big and large, and suggest indicators, some of these indicators that could be benchmarked against available population-based data, both at the district and national levels. So some data could be located within a program and others that could be benchmarked against. So you can see how different programs are differentially, incrementally impacting and contributing to achievement of national level data. And our guiding principles in the work that we'll do in this is that really we'll be working with a range of partners. It will be a collaboration between partners to brainstorm the theory of change for their programs. And we'll also be giving strategic guidance on implementing organizations' conceptual frame and measurement, because often we find when we begin to work on evaluations with some of our implementing partners, we end up really helping conceptualizing even the work that they're doing. And then identify standardized, robust indicators that can be applied to a range of settings. And lastly, that it would be an adaptive and iterative approach of refining what we measure with triangulation across data sources. And I think this is my last slide, is that what we are taking from all of our learning of working on these other programs with young girls, and with what we are really bringing into this framework that we are going to be developing is the points that have been made. So they're really summarizing what I've said. Need to better understand the individual paths girls traverse. So there are different realities for different girls, unique challenges and unique wins, and make measurement more aligned with reality. Need to both conceptualize and contextualize data. Need to develop an understanding of these complexities amongst our partners. And then lastly and most importantly, need to be strategic about what additional evidence we need. So because the idea is not just about measuring everything, but really what is the most strategic, important indicators to measure. Thank you. Oh.
Thanks, Priya, for sharing your insights. We'll have a quick question and answer session. So.
Yeah.
Hi, I'm Sarvoparita. I work with Mumbai Smile organization, Mumbai Smiles. My question is, when we talk about life skill education or life skill education empowerment for adolescent girls, it's a big package, which is not only one domain, but it includes health aspect, it includes education, as you already spoke about it. So my question to you is, when we want to ensure, when we are already implementing or designing this program, if we have to ensure the holistic development of these girls, how do you actually measure these indicators, or what could be the main indicators which can help us to maybe probably enhance or improvise on our programs?
Sure. Yeah. Okay.
My question is really about, you spoke about, measuring change and improvement, but has there been thought about measuring and identifying certain benchmarks in certain geographies so that implementing partners particularly can look at where they stand vis-a-vis where they should aspire to be?
Hi, I'm Kiran Shaiva from iDobro. A question, as you said, things change from region to region, things change from society to society, even within the same village probably, and between different... and sometimes I feel when we use frameworks, I think that is one element which we do not kind of highlight. You know, it is part of the indicators, it's part of the list because it's a customized program which is for you yourself. But somewhere, and of course, because I'm a part of COE as well, you know, and Sonal is here, I really want if maybe somewhere we think of it from a technical point of view that in some framework, in some way, if we can start highlighting those customization, I think it helps a lot of other people understand that this, while the frameworks are standard, these are areas that perhaps need to be looked at separately and out of context, actually. We keep talking about in context.
Absolutely.
I think somewhere we need to bring into frameworks out of context as a standard reputable section.
Absolutely. Should I respond to these three? Or yeah? Okay. So around the life skills education programs and the need to have comprehensive indicators, I think one of the things I'd like to say that even life skill programs, education programs that exist across the country are fairly non-standardized and fairly differential in quality. So even though we think we are doing the same thing, but we are not, I think that's a very important thing to know, is that I think what we really need to look at what in that particular context is the program really intending to do and what is its goal. So a lot of life skills education programs may be really intending to delay marriage. So a lot of the content of how the program is transacted is around delaying age of marriage, and therefore what you might really measure is delayed age of marriage. But then I might say that the comprehensive indicators should look at employability and economic agency. But if that program never transacted that and never built that as a pathway, why would you expect to see that change? So I think very important to say what is the input, what is the content of the program, and therefore what do you expect to measure. So you can't just say life skills education programs because they're not generic, they're very content specific and fairly diffused in quality, if I may say so. Because we've done observations of quite a few, and what we find is that definitely areas of sexuality and gender and power get very compromised, and there are other areas like health and menstrual hygiene that do get emphasized. So I would not say we need comprehensive indicators when you didn't do the content. However, if you ask me what are some of the holistic development indicators of adolescent girls programs, I think building girls' confidence and self-efficacy is absolute and essential, no-brainer set of indicators. At least minimally, irrespective of what you taught them, have you aspired them for a better future? Have you made them more confident? Do they have higher abilities and are they more resourceful? Do they know where the opportunities exist, and do they know how to plan to get them? I think that whole set, that's really breaking down empowerment. So it doesn't matter whether it's about gender-based violence or it's about menstrual hygiene or it's about nutrition. I think it's self-efficacy and confidence is those set of indicators really contribute to all of these domains. And I'm not saying that's the only thing, but definitely I feel being more resourceful, being more confident, being more aspirant for your future are very important indicators, and any good life skills education program should minimally achieve this, and then you could see the delayed marriage and the improved menstrual hygiene and improved knowledge of family planning, etc., which is what typically programs do end up measuring, a lot of knowledge indicators. In terms of I think your question was about benchmarking change, and I think that's an area, of course there's a lot of macro and the global work that happens with the UN organizations. You have indicators and they are benchmarked, they're national indicators and they're benchmarked against global indicators. We know those exist, but often implementing organizations and programs are not gathering data that can be benchmarked against district and national level data. So when you look at many measures like percentage of girls in schools, you'll get from the NFHs. But around how many girls miss school and how did you improve school attendance, you might not get that that kind of indicator might be much more located in a particular context and you may not be able to benchmark. So I think the work that we are doing in this framework is to recognize that what is the available population and district level data where program level data can be benchmarked. So at least minimally there is some linearity between some data that is local that can be benchmarked against national. So that is the idea with this framework. And I mean, it's an emerging and a new area even for us. So just to respond to that. You know, talking about the contextualization, I mean, that's really the critical issue. I've kind of emphasized this a lot in what I've presented today. And the way we do it, I mean, Kiran, you were saying that frameworks are deficient. I think I would like to say let's make programs less deficient or more inclusive of realities and context. So the way we did it for the program that I talked about, the garment workers program, that was in 7 countries. And it was the same framework and the same indicators, but the way we did it is the measurement of that indicator was applied sometimes differently. So what self-efficacy means to a young garment worker in Cambodia may be different than China and may be different in Bangladesh and may be different in India. So the contextualization of that, for a girl, a migrant girl from Cambodia, it might be just learning how to cross a busy road. And I'm not joking. For somebody else in another context, it might be just handling money because she's never earned an income, never handled money. For somebody else, it might be negotiating for a higher salary with your employer. And not that that indicator is not important for the one who doesn't know how to handle money. But for example, if I asked a question in all 7 countries, do you have an ATM account? Well, in countries where their banks have just begun to open and there are no ATMs, that question is futile. But if I ask this question in China, where almost 90% of the girls had ATM accounts, that question is also futile. So really, of course, the context matters, but that doesn't mean the framework doesn't allow for you to contextualize it. I think it's our recognition as to what that context is. And I think formative research and really understanding your context before you develop your indicators is critical for that.
Next presenter for the day is Anjali Dave. Anjali Dave is a professor and chairperson of the Center for Equity for Women, Children and Families, School of Social Work, Tata Institute of Social Science. For long years, she has worked in the area of women's issues, which includes developing socio-legal interventions, research and capacity building for violence against women. I would now request Anjali Dave to make a presentation.
Presentation is right here, and you can use this. Which one did you say? This is to go forward, this is to go back. Sorry, good afternoon, hi. Okay, many familiar faces, and so I want to say hi before I say anything more at the moment. You know what Priya has just said, I kind of, in a way, will continue more specifically to the study and say what kind of things we had to do, what kind of research did we do in terms of evaluation of a particular program, and then what were the kind of outputs that we got out of a program like that. So while we were talking in the earlier session more in terms of a framework, I'm kind of going straight into a study and then how did we use it and then what does it mean, and actually going through the steps itself. Yeah. This study, as may have been mentioned, was done about 10 years back. We don't have many studies coming up on evaluation on violence against women, which continues to remain an area of huge difficulties. Not just the issue is difficult, but even evaluation of those kind of programs the impact is difficult, and I'm just going to be able to talk a little bit about that. So I need to introduce the program itself a little briefly so that you are able to understand why what I am saying, and therefore how the difficulties do arise in that particular process, the research study and the impact of the study. Sorry, boss, what did it do? Do I need help? Sorry. Is this it? No. Okay, so the Special Cell for Women and Children is a program that we started in '84, an outcome of the women's movement's demand and expectation from the state government and the state institutions to respond to the issue of violence against women. And that's how, when we started a small little unit which was called the Special Cell by the police, where 2 trained social workers began doing interventions to deal with individual cases of violence against women. It started with domestic violence. Today we have an act, but that's how it began. And then we have a host of other violence also being reported by individuals or small groups to say there is. TISS has been continuing to do the implementation, research, police training, documentation, policy, law on deviant expansion and extension. That's how it has been working for the last 30 years. It's a strategic alliance with the government of Maharashtra. It began with Bombay Police, went on to government of Maharashtra, took on the government of Maharashtra WCD department, and UNIFEM, the earlier form of UN Women today, got into an MOU to get into expansion of this particular program. And this particular program, after the MOU, required an evaluation for it to become an administrative measure of the government. So it was absolutely mandatory that we have an evaluation. And we didn't have any of the things that Priya talked about, because in '84 we didn't think evaluations and impacts and outputs and outcomes. If I now look back and show you that it was a 2.5-page letter, not even 2.5, 1.5-page letter that we sent to the Ribeiro, then Commissioner of Police, to say we would like to come and work, and he wrote back another half-page letter saying, thank you very much for your help, please join us. So that's how we wrote a letter, and where he said, 3 years we will work with you, we will experiment. And he wrote out a nice little letter to say that we will all, please everybody in Bombay, help these 2 workers who are coming from Tata Institute, and be very kind and benign to all of us. So it was very, very pleasant, very, very, not these things that we are talking about today, which 30 years back didn't exist. We did have objectives, we did have a plan, but we did not have what we are thinking of, what we've evolved into 30 years down the road. So since 2005, we have a government program now, and this has, when we began again, we thought we were demonstrating for 3 years. We never thought it would come to 140 special cells in Maharashtra, which when we even planned in 2005, rather 3 and 4, we thought of 1 special cell per district. The government scale has made it go to 140, which has changed the whole the horizon of what we are doing in terms of work, because the minute Maharashtra government has accepted it, we had today 4 other states accepting and moving on and taking on the same kind of work. Not the same, similar, tuned to their socio-political reality. And that's very important, that how this evaluation helped to look at that kind of realities too. And we are demonstrating the same kind of work in the next 4 states. And when I say 4 states here, I'm saying that this is a government program of the funded or grants and aid by the government. And that's been our idea. So the structure, as I said, it is 2 trained social workers. We are in the police offices. They're full-time paid workers. Organization development is the responsibility of TISS, police, and the state level monitoring committee, with other NGOs along with it as 2 members, but we are the organizing body and implementing body. And we have everybody has the police infrastructure shared with us for the particular project. When I mean writer, police calls them administrative people. They're writers, people who write, so while they do. So that's why the word writer. Now, which are the key defining interventions of the special cell? Now, these 10 indicators, monitoring indicators, emerged as part of the evaluation study. We were to look at monitoring indicators. We needed to create monitoring indicators which then could turn into evaluation indicators and then become the evaluation study itself. And this we came to only sometime in early 2000 when we had to do the study, because now we needed to tell the government what we've been saying but not having any kind of data or proof about. So these are the 10 areas, basically working for non-violence with variety of stakeholders, building support systems for women, engaging police help, working with offering legal aid, providing emotional support and strengthening the psychological self of the woman, development counseling, advocacy for group entitlements, means being part of campaigns and all kinds of other kind of group entitlements for women. Re-establishment for women's relationship with their economic assets, arranging shelter for women, and working with men in the interest of violated women. And when we talk of men, we talk of not the husbands, partners, or only the violators, but we talk of all institutions which have men within them, which allow or do not allow for facilitation of women, violated women. So that's how police, judges, community leaders, and so on and so forth also would be part of that work, because you just don't talk work of institutions, but you work with men within that institution specifically too. Now, so what does come as the focus work of the special cells? We work on specifically on violence against women and children. It's not marital discord, it's not maladjustment, it is anything and everything that can define, and as the definition expands on violence, that would be part of the work of the special cell. Essentially because we define that we sit with the police. If we are sitting with the police, it has to be violence. It cannot be talked about as only psychological, work or psychosocial work, because this is potentially crime. And therefore we are in the crime prevention aspects too. Facilitating spaces for women within the criminal justice system, specifically the police system, working with police at structural and individual level to deal with violence, including training, research, and documentation. Dealing with large number of potentially social legal cases of violence against women, because this could be both cognizable and non-cognizable cases, which means where police can take action or police cannot take action, both kind of cases, but that's where we would work with. And there might be places where police have taken cognizance, and yet there is a whole lot of work to be done in terms of the social legal work, and that's where we would continue to intervene. And these are full-time trained personnel to deal with violence against women. These are not volunteers, not people who are, because when you're working with formal systems, just volunteers do not add too much value. You need a lot of experience and a lot of confidence for people in formal systems then to acknowledge you and recognize you as somebody who of worth to talk to in themselves. Otherwise, it's quite easily these institutions can, bypass you as people. So, to come back to the evaluation study specifically, we sometimes, as soon as we got this acceptance as the MOU that we will now go into expansion, and this was only after 18 years of work that somebody allowed us to think expansion. And where it was very clearly written that there would be an evaluation after 3 years, and at the end of the 3 years, this would be it then can become a regular administrative measure of the government. It's a very, very, very key important sentence of the MOU. And that's how we began the work, and we thought we will do evaluation. Meanwhile, the police who were now, we've gone into Maharashtra, it was not only Bombay. So the police wanted us to tell them what will they supervise us for. They were police, we were social workers. How is police going to supervise? How will they become our bosses? How will they know what to do? And therefore, they were very, very keen that we develop these monitoring indicators for them to be able to inspect us in certain, and that thought, I think, was most professional thing that he could have thought of at that particular time. And that's how we began the work of monitoring indicators. Meanwhile, so we had a strategic management exercise and a group which was to think of how to expand, because we were going from 1 and 5 cells to 10 cells. What was the role of the expansion? Then took on the monitoring indicator role, as well as then took on the evaluation role. We had to develop quantitative indicators for qualitative work. We were doing a whole lot of work with individual women on social, emotional, psychological work with individuals, with families, with their communities, with their family members. Now, how do we measure all this qualitative work, which everybody was convinced about, but needed to be turned into numbers for government to be able to accept that? And government means scale. And so we had to develop quantitative indicators for qualitative work, and that was one of our first challenges. Yeah? Today we have a whole lot of things that are already being talked about and thought about. Even Naila Kabir's work, which talks about intervention, tells you of a larger concept, a larger frame. But to make the fine-tune indicators, to be then able to convert them to be able to say that yes, it is effective or not, was very difficult, because success is not what we were going to define, because success would mean we were a big failure because there were more divorces and people moving out of relationships, violent relationships, then getting back together. And that is a success understanding largely in society or families. What happened also is that the social workers themselves found it extremely difficult to be able to say what were they doing and how were they doing that. So that whole exercise of creating the monitoring indicators was one of the roughest exercise I think social workers have ever done in their work. It was easier to deal with violated women, police, government, judges, but to start looking at yourself critically and say, what is it that you've been doing and why are you saying that you are so effective, was very, very difficult. So to say that the next time after 5 sessions or 5 meetings, you know, on the 5th day, she came with a bright new sari and a gajra in her hair, cannot become a quantitative indicator to be put into how many women wear gajras and came. So if you get what I'm trying to say. So it was becoming extremely difficult, and though I'm making it, you know, funny sounding, it was a real threat to social workers, all of us, to say that we knew that we were convinced about our work, but how do we convince the world, and then how do we create these indicators? And I think this is one of our biggest challenges in terms of how do you create indicators. This, of course, all this also was happening and was a lot more easier because we were at TISS, we were people who was not outsiders, so we were people, faculty who was helping us out, faculty who knew of our work for so long. So they were from different kind of contexts, but in different departments, but they were familiar of the work. So, of course, the strategic was part of the social workers was part of the management exercise group too. So we had the project coordinator, the project director, and a few of the 5 social workers who was a team. So it was an internal team looking at internally, and it therefore even more difficult. Because when somebody from outside comes, all you have to tell them is, you know, do a good show off and feel very happy and satisfied that you did very well. But when you have to look at it yourself then again. So our objective was to understand the profile of the violated woman who approaches the special cell,
Though we've had researchers before, we needed to do this because now this was across districts in Maharashtra, and therefore we wanted to know what was a different profile, if at all, from district and villages that were coming to the special cell. To understand the expectations of the women from the special cell and what were the interventions received by the women, what we said that we do is how it is. The scope of the study was population was to be the women applicants during the year 2003 from 10 special cells supported by UNIFEM. Sources of data, primary source, that means the women clients, a structured interview was created, interview schedule was used, and the secondary source was from the registrars maintained at the special cells by workers was used to draw at the profile of the violated women. And women's interviews were at the special cell, their workplaces or their homes. Or, as I will continue to say, in outside many spaces to deal with how women wanted to talk to us. The research team, as I said, and we had, finally when the whole research design was ready, we did draw on a consultant to then take this on and not ourselves. So then it became, so we had a consultant, 2 investigators, and 2 research assistants through the whole thing. The sample size was 303, approximately 30 women clients from each cell were interviewed, that is 25% of the total referrals during 2003 and per unit. The selection of sample was selected by random method from referrals to each cell. Men's and children's cases were not taken because we were looking only at the women. And the cell workers contacted the women client taking appointments for the interview. So the workers who had intervened with these women were the women who would speak to them and make the first contact to say how would it be and what it is. And we had to go through a couple of rounds of random sampling because there were women who had moved out of their matrimonial homes. They had moved away into different spaces. They had gone, they didn't want to tell us where they were anymore, so they had to change locations, so we didn't have addresses. So this random sampling we had to go through 2 to 3 rounds before we were able to get the number that we needed to for a reasonable study. Now let me tell you the efforts and issues in data collection that took place. The sample selection process had to be repeated. As I said, the clients had, for a number of reasons, the clients had moved residences and new addresses not available, or they moved from the district itself. The clients were out of station during the week of data collection due to ill health, last stage of pregnancy, etc. Dissatisfied satisfied clients refused to participate, not all, some. Clients' in-laws and or husband had felt threatened by the communication from the special cell, and they did not want to talk to us anymore. And difficulty in talking to women alone, because invariably women always had somebody of so-called what we would like to think hovering around them, so that what kind of data and information is given would be controlled. So what was our results and what is the profile of the woman? She is married, 89% women between the age group of 18 to 34, has completed school, low income, lower middle class, 70%, has had 50% of these women had physical injuries. They had been beaten regularly, that is 50%. She had taken help of parents, had registered non-cognizable offense registration, that is more than 41% of women had already been to the police station. So it's not to say that this is the first time. They've already been there, they're dissatisfied with what has happened to them, and therefore now have asked for further help. So they've already registered NCs. And NCs were not enough at that time, had also gone to caste panchayats for redressal, and she hailed from both urban and city and town. So it's very interesting to understand, which was the first time we realized this, that 45% of the women were from cities and towns, but 30%, and this was the first year of expansion, more than 30% of the women came from villages. So as soon as you set up a system, as soon as you set up a service, women do arrive. So what we like and what people like to create to say violence against women is within homes and it's not known and it's kept in the four walls of the family. All these are ways to say, let's not even look at that side. And I don't think we need to take this very seriously, and nobody wants to talk about it. And we found in another study that every case of 498A, that is, I don't know if you all know 498A Indian Penal Code, where cruelty is what we talked about, every case in the police, somebody knew about violence. Neighbors, family, friends, relatives, colleagues, somebody knew about it. So it was not that women had never talked about it and she was so ashamed that she was never going to talk about it, and so on and so forth. So there was always somebody, and therefore this thought that there are no witnesses to violence against women is not really true. Interventions at the special cells have brought changes in her husband's behavior. She thought, women said, more than 47% felt that there was change in behavior. I'm not going to go into every detail because that I have a report in case you want to know as to what were the indicators, what were the changes, and so on that you want, then I will read them out. But in the larger changes, because every table if I go, I might be here for next few days. Decrease in mental health, mental violence, mental harassment, 14%. Physical harassment was more, where we were able to stop that more than the mental harassment, that was 37%. She felt emotionally and mentally strengthened, what you were talking about, confidence, building that particular thought. This is where we said more than 50% women felt very strong after coming here and feeling that they would be able to, fight this reality a lot more. Women were satisfied to a large extent. That is about 57% of the women who came said they were very satisfied. 31% said they were to some extent satisfied, and there were 9% who said they were not at all satisfied. So we did have a good number, and the people who said they were not satisfied were essentially where police was not did not use their danda against the man to do what the woman thought should be done. So we had, because of this, coming to almost 88% women saying that some amount of impact and effect was there for having come to the special cell, is the only reason the special cell became a part of the government. So this is what my main benefit for all of us to look at in terms of the issues of violence against women. This was what it was. Let me go quickly on to the reflections on the methodology. And I think this is where the major issues are. All the things that we say about methodology in terms about our rigor, research is rigorous, and that tells you scientifically the best thing, and so on and so forth. And once you are able to do research and then produce your data, then you are saying something of consequence. In violence against women, also you might want to think similarly. But what is it that we needed to continuously take care? We took care in spite of it. This is what we found, and this is what I'm going to say, that the recall of crisis, painful times, difficult memories, emotional pain, loss of memory, confusion, blurred memories, influenced interviews. We do remember that this was not qualitative data, so we were to be able to only do interview schedules. We were not doing in-depth interviews where you could sit, talk, chat, come back. She didn't want you to come back. She didn't want to come back to you. She came because she felt thankful also. There were any number of quotes where the women have said that, what all the workers have done, and so on and so on. And finally, one of them also said, she did everything that she could do for me. But my naseeb was so that I could only get so much out of that in my context. Which means that for the woman, just the sheer service was such an obligation, not obligation, such a sense of privilege that she had got, that everything else she was ready to let go, even if the worker was not as effective as she would have liked her to be. But the recall of crisis and the painful times, the difficult memories, did not always allow for very, very clear answers. And that's where our difficulty, I will try, if you have questions, then I'll tell you it in that sense. Questions asked were progressively complex. If you remember the objective, there were 3 questions. One was, what is the profile, which was secondary data. Then what were the expectations from thing, which was easy to say, this is what I wanted, this is what I wanted. This. But when you talk about interventions, so did you feel good coming here? Do you remember that? Did you feel heard? Did you feel liked? Did you feel respected? Did you feel valued? Now, if I have to ask all this, I have to give you contextual illustrations for you to get you that. By the time it becomes more and more complex because you've gone through a whole lot of questions. Finer, what we said in the early session, reiterative, multiple responses to, but women did not answer as much, felt tired, needed tighter and specific questionnaires. Women of few words, they've said, not comprehending the need for this elaborate, unnecessary questions. We look for corroboration, which was not always helpful for women. Okay, so you did reiterative, so that you asked it here this way, the next time you asked it there that way, and she's saying, why are you going on and on? Why are you saying, I said that before? So we looking for corroboration in methodological terms, but for the woman, you are troubling and trying her sense. And because of the earlier point of crisis, painful times, because that's what she's looking at. She's not looking at, it's not trying to say that, can you recall the first date and the romance that you had with the man that you liked the best, or the woman you liked the best. She's not recalling those memories. She's recalling painful, difficult memories. And that's something which we need to review as to how does methodologically you're able to how far can you push in a literal sense? A profile of the women, their socio-political environment, what to do is, it's my luck, difficult to understand categories outside their experience and imagination, especially related to self. This confidence, that sense of self is not there. That I is an important concept. Now we are going about asking for it. You have something called self-respect. You have something called dignity. But we are trying to find so much more, which is not yet emerged because she's not paid attention to that self as much. And in us trying to find out where all have we made impact, we're digging into spaces which she herself has yet to explore. And then you're asking her to explore it at a time it's been a difficult period. If I look at the numbers, when I said it was about 12%, did I say that? If we looked at the mental harassment, it's only 14%. The researcher says that this 14% sounds very small, but for that woman who told us, it's a huge movement. So our numbers are not always able to represent for that each individual, what is the journey that they have moved. Which technically, supposedly, your case studies will tell you, your case histories will tell you, but then that one government does not want that at this moment. So it becomes, and you do both the methods, and you try and do triangulations, and you do all kinds of your research understandings. By that time, you've wrung the woman out. I mean, she's already wrung out, and all you're saying is, now come, let me try again, and let's redry you, kind of thing. It's literally another whole thing. So the even small is very significant, because in emotional and mental terms, there are giant steps that have been taken by an individual. Only 2 responses were envisaged, yes, no, or no response regarding interventions. Predefined categories not allowing for any hues and colors. So if I say something that, did you feel valued? Yes or no? She may have something more to say that for this I was valued, but that I was not valued. Now how do I put both? Because many things have happened in the special cell. Then how do I take that? And if I create a third category, that doesn't still bring us the shades. So there are those limitations, but in quantitative way of going about doing. Longitudinal studies are required, is what we think. Slow change, hence measuring difficulties to assess where she was and where she is now. We never had that kind of baseline surveys that we talk about today. Duration of intervention, life stage, time gap changes, all these change the picture. So which age what happens, at which age more impact, which age less impact. All that we have data only which is anecdotal. But then how do you do this takes a long thing. We had a lot of tables. They had to be read together, but you could not do cross tables and multivariates and things like that because it was making no sense. There was no hypothesis in itself. So there was very difficult to do any tests and things like that. So it had a little bits of those gray areas that we couldn't completely do a clean job there. Quantitative method in this case definitely gives you a direction, but not all the answers. It told us that yes, this makes sense, but that's not all directions which we might think that the evaluation will tell us all did not work. And logistical arrangements do affect interviews. So spaces like, we saw that we didn't go in police cars or we did not go in certain other spaces and kept telling them earlier, come out from where you are working so we can speak for about an hour. So she would speak to us in the lunchtime. You know, things like she didn't want her husband to know, she didn't want her in-laws to know, she didn't want them to at least come near us, at least not to re-meet, and so on and so forth. So all this allows for the tightness of thoughts also to be able to tell you all kinds of details. Well, so having done the research, these were some of the gains that we at the special cells had, apart from having the expansion, which was to convince the government that this made sense. For the program itself, what does it do? It built trust. It builds trust with the workers again, communicate respect, perspective building on domestic violence. Helps build trust with the worker to say that, am I more than time up? Oh God, okay. I was happily talking away. Okay, so I'll go quicker. Networking with caste panchayats and other services, conscious use of skills, because social workers not always able to, all interventions don't always get very easily conscious as to what you need, but this detailed kind of response that we got from the special cell, from the women, allowed us to know what better we could do, where we needed to do better, what we thought we were doing very well, but actually that was not what did come out. Bettering office environment and reference materials for ourselves, documentation, upgrading skills for better effectivity, and a lot more expectation of us, from us on developmental counseling rather than only crisis interventions. Towards preparation of the woman better, meaning how better we need to do the woman to be able to go back to the, hopefully a non-violent space, understand the context of the violence better, for her to know why and what she needs to prepare herself. That's what we think we need to do more. Create documentary evidence for women. Join meetings and groups meetings where women, this is one of the strategies that we used, and therefore prepare the women better to come into group meetings and be able to confront the aggressors or the violators. Visit to police officers, which though we are in the police system and they have come to us first, without us, they came to us. And yet we need to prepare them better to deal with the police. And long-term inputs is what was required. Some overarching gains, each unit identified their own strengths and gaps in the districts and own space. Affirmation of co-work and the work of the strategic management exercise group. Overwhelming response of women to what started as an internal resistance to evaluation in special cells, that, you know, the special cell workers were most worried that they are going to be all told that, you know, they're not doing at all anything. And if 88% of women felt that, well, there was something that we were gaining from this kind of work, was a huge
huge, and obviously overwhelmed by the fact that something like this could be recognized by the women. The picture of larger satisfaction is clear. Upscaling has begun, and now that what we said was upscaling in Maharashtra is at 140, and now 4 other states taking it on and things like that. So upscaling has begun. Key learnings, of course, is measuring a fine process within a women's socio-political environment, local research followed by affirmation of other indicators and wider compatibility. Because otherwise we feel very happy with ourselves that we've done very well, but then you suddenly find that, well, some other research and some other data is telling you something completely different, and therefore what is it that we missed out, or what could we add to ourselves? Thank you.
Thank you, Anjali. We can have just 1 or 2 quick questions, and then we can move ahead. Okay, then can we proceed? Fine. So now we have done with the presentations, and now we'll have remark. Oh, sorry. Do you want to ask one? Yeah.
You know, I was just wondering, when you look at your work, it's more from individual point of view. When we're talking many of the other examples, it's more community-based that the approaches. Do you think there are any significant differences, you know, when you take those kind of approach towards evaluation and impact and outcomes, when it's more about individual rather than a community-based?
If you're talking about I don't know how to answer this very cleanly. As far as data collection, I can understand if we were talking about it in preventive context and the remedial context, but not as in a community context and in an individual context, because at the end of the day, when you do methodologically, you do talk to individuals, either way. And you may do focus group discussions or whatever, but at the end of the day, that's where you would go back. So if you're looking at in terms of preventive, and then you're looking at you know, more remedial kind of spaces, then yes, things would be different. Because here, you are not saying that this is potential for violence against women, and therefore how you're going to go about dealing with it, and therefore what are the kind of programs and campaigns and things like that you're doing. While here, violence has occurred, and now you're going to look at, so obviously there would be difference. So it's a response to the act of violence that has already taken place, and then you're doing. So if you look at it from preventive and, you know, this then is obviously there would be a difference. Yeah? Is there anything else?
Thanks, Anjali, for your presentation. Now we'll have remarks by a discussant for the event, Dr. Sonal Zaveri. Just to briefly introduce Dr. Sonal. Sonal is an independent consultant and evaluator, founder member and secretary of the Community of Evaluators South Asia. She is also an international advisor to the Child to Child Trust, University of London, UK, and an advisor to the Feminist Evaluators Network. She writes, trains and presents on issues of rights, participation and gender, and in the use of utilization-focused evaluation, feminist evaluation, and participatory empowerment and transformative approaches. Sorry? Okay, yeah, I can take away the laptop. Yeah.
Thank you very much, and I'd like to appreciate the audience that has sat through these wonderful presentations. I'd like to appreciate the collaborative effort that CLEAR, Community of Evaluators, UN Women, DASRA, they've taken a lot of effort to get this event together. And I would particularly like to appreciate that we have moved out of Delhi and we brought the roundtable to Mumbai. And I hope that you're going to have more traveling monitoring and evaluation roundtables, because it provides an opportunity for many thinkers, evaluators, implementers to share in a discourse which is of such importance to all of us. I'm just going to make a few broad remarks as a discussant, and I'm sure there are other questions that you would like to ask at the end of what I'm going to say. And it's going to be a bit difficult because we had such three fabulous presentations of a varied nature. We had Anju and Shrishna talking to us about an anti-human trafficking program, the complexity of it, getting various stakeholders, and how difficult it is to actually try to measure what is happening in each of these different sectors, stakeholders, and the intersectionalities of all of this. We also heard from Anjali about the evolution of women's cells, and it was a fascinating journey for me, because when I was a student at Tata Institute, this was really one of those issues in the forefront, and it was really path-breaking to get social workers to be sitting in the police cells and to talk about issues of violence, which was considered in that something that, oh, this is ghar ka mamla hai, this is not what we get into. So I really enjoyed that discussion, and particularly the difficulty in measuring impact. And I think, and I really like the way the reflections came of what worked during the evaluative process itself, what we were able to understand from the evaluation and what we were not able to, and what we were able to report and what we could not report, and yet it was of such great importance because policymakers and decision makers do not value that sort of knowledge. And Priya talked a great deal about difficulties in trying to understand how to measure empowerment. And I know that they're grappling with these issues, and I, for one, am looking forward to getting more details about this once the project goes on. And particularly, we are trying to look at those sort of measures that you can go across various contexts, at the same time be context-specific. I wanted to start actually talking about gender evaluation and violence, which is the theme of our roundtable in the backdrop of what Mumbai is. And I wanted to come back to the violence that has shaken Mumbai with the Shakti Mills rape case that took place and the recent judgments, the death sentence that was given to these perpetrators. We see a tremendous cry for public accountability. But I would like you to think as implementers, researchers, and evaluators, to look beyond that law and order issue, to look beyond certain projects and outputs and achievements and activities, and to think about what is it that we can seize the opportunity for. Can we look at broadening the discourse of violence and gender and looking more deeply into the social cleavages, the inequities, the gender imbalances, and how do we address these issues, and can we broaden that discourse so that we are able to provide a sort of a momentum and for our community as well as those who make important decisions and policymakers to take cognizance of what we are trying to say. We also have now a very politically charged environment. When you're talking about gender, we have our elections in Mumbai, just 2 days hence, and I just wanted to quote from politicians you have probably heard on the media, on the television. When the death sentence was proclaimed by the courts here, one prominent politician said, "It's wrong to give death sentence for rape. Ladkon se galti ho jati hai, boys make mistakes, and if we come to power, we will change the law." And then closer to home in Maharashtra, we had another prominent politician, and he felt fit to give a religious twist to the whole concept of rape. And he said rape is punishable by hanging. But here nothing happens to women, only to men. Even the woman is guilty. And he goes on to say that girls complain when they are touched and they complain when they are not touched. And he says it becomes such a problem because, and I quote, "the man's honor is ruined in this." I'm quoting this because I want to state that whenever we talk about empowerment, violence, gender imbalances, we have to talk about it in this wider social context in which it is surviving, in which it's being perpetrated. This ecosystem where the violence is in the black box of the family that Anjali was talking about, or whether it's in the public spaces or in the trafficking and so on. And we also know of the very, very low priority that's been given to anti-trafficking. Look at the number of registered cases, abysmally low. Are the main perpetrators ever caught? Never. It's a high profit and a literally low risk transaction. Whether we talk of rape or domestic violence, whatever is reported is just the tip of that iceberg. And so all the three presentations that we're talking today were trying and grappling with this whole idea of how do we measure change when we are putting our efforts and our interventions in place. How do we do it? Is it just the numbers, or can we do something more than that? And so whether we talk about prevention of trafficking, empowerment, or whatever it is, this is something that we need to look at. And so I'd like to ask, as evaluators and researchers, what is our choice? What is the choice of the evaluation framework or tradition that we would like to use when we discuss issues of empowerment and violence and trafficking and these gender imbalances? Should we use a positivist approach, which is a neutrality, where we say that we are very scientific and we have our, external ideas and standards, and we try to use them in the best way possible, devoid of any ideologies, very objective? Is that the best way for us to address gender, violence, and empowerment? That's a question that we need to ask ourselves. Or is it important for us to take a position? Can we take a position as evaluators and say that evaluation, after all, whatever finding you produce, is going to be political? And what do we call a good evaluation? A good engendered evaluation should, in fact, be talking about inclusion and inequities and intersectionalities, and it should be transformative in what it's trying to achieve. So why can we not take a position like that as evaluators, researchers, and implementers when we are grappling with these very complex issues? Priya did mention a bit about the evaluation frameworks. Batliwala and Pittman have done a very interesting analysis of these frameworks. And as I said, Priya did mention that. And what they did was they divided the prevalent frameworks into two binaries. One they call the causal and the other's contributory. So the causal is all the very logical framework, the results, what have we achieved, we've start from here and we end up there. Something that we are extremely familiar with, and many of our policymakers are also. And then we have the contributory ones, where we talk about, most of our participatory methodologies that we use come from that, or outcome mapping and so on. And so here we have, that's more, trying to get the voices of people from where the interventions are being held and so on. But what Batliwala says that's really important is that gender analysis frameworks have always borrowed from both these traditions. That's nothing new. We have moved from quantitative to qualitative to the causal to more participatory approaches. So that's nothing new that we are talking about. But what she does say is that neither of these, whether you mix them in 20, 80, 30, 40, whatever you want to do, that they cannot capture the complex changes. And we have seen the various nuances of what we were trying to capture. They cannot provide us some analysis of these complex changes that come across gender relations and so on. And they pinpoint, and again, as Priya has mentioned that, they pinpoint that one key factor which is missing from this is the reflexivity. It's questioning our assumptions, it's questioning why we are doing what we are doing, for whom, and so on, and whether the theory that we have started off with, that this is going to lead to that, is that actually working? So it's actually trying to be, as evaluators, we become thinkers, and trying to constantly be reflexive in what we are doing. And they say it very nicely. They call it the 2 steps forward and the 1 step backwards. And a lot of you may be familiar with that, saying that the change is not linear, and we've heard that from our presenters today. And that even those little bumps that you find in the conflicts or in greater violence is actually telling you that something's working. But that's something that we know. Are we able to address our policymakers and inform them that this is what is something that you should be looking for and saying that, yes, this program is working? So these questions and the subtle nuances, that 14% change that you were talking about, it's a huge change, a small little change of somebody saying that, I'm able to do something. It's a beautiful example that I think Bhattiwala has given, is that when they were talking about how do we measure self-efficacy and confidence that we're talking about. And when they were going and asking the women, how should we do it? So the women said, can the woman raise her eyes and look straight at a person of authority? And for them, that was an indicator and a measure of empowerment. I think what I'm trying to say is that all of these discussions I'm talking about is actually leading me to saying that this is a feminist approach to evaluation, and again, Priya talked about it. And all the three presentations, and even Anjali was saying that, in those days we weren't really thinking in those ways. I think the very fact that they were trying to work with with women to find out what they've experienced, and how to do it, the entire debate that the social workers did in questioning that how do I actually portray and see that change and the empowerment that I've seen among the women. All of that is actually all elements of feminist evaluation, and we have a structure for that now. And I thought I would just share with you briefly with the audience, because I saw elements of all of that in these principles. There's a new book that's come out actually just this month on feminist evaluation and research. It's an edited volume by Guilford Press. And in that, they have described 6 principles of feminist evaluation. And I'm just going to go over them quickly because you will probably, when I say it, it'll start resonating with some of the presentations that you've heard. First was the central focus on inequities. And that says that the questions we ask, the questions that each of these presenters are looking for are, how do we formulate our questions? What do we focus the discourse on? That is a choice. And that choice that we make is going to ultimately influence what we report. And the second principle of feminist critique is that all inequities are structural and systemic. So Karen, the question that you were asking is that, is it individual or community? Yes, we need to capture not just the individual change that happens, but have we able to make systemic or structural? Similarly, in the anti-human trafficking, we have all the systems in place, the different communities and the panchayats and the sort of groups, community groups that have been created. But really, even though we have created those groups, we've had the meetings, we've had the capacity building, has there been any systemic and structural change in any of the inequities? And that's something that's very valuable to capture. The third that I'd mentioned earlier is that feminist evaluation, and you may not want to call it feminist because some people don't like that term, you may call it engendered evaluation or gender sensitive or equity based, whatever you want to call it. It's definitely very political. And so we accept the fact right from the time that we begin our evaluation that the context is politicized. And I talked to you about how politicians and the socioeconomic and the political environment is. It is definitely charged, and we need to take the bull by its horns and talk about it. And we also recognize that we as evaluators are also political. We are bringing our own values, our own experiences into the arena of evaluation. And that's not a bad thing, because we are not talking about a position of neutrality. We are talking from a position where we say that we need to address inequities, and this is how we are going to do it. It's very interesting that of the 6 principles or ideas of feminist evaluation, 3 of them, 3, are devoted only to knowledge. And so we have, as the 4th principle, that knowledge is a powerful resource, and that the purpose of knowledge is both explicit and implicit. And we need to be very careful of what is that implicit purpose for which the knowledge is going to be used. So you may have very powerful stakeholders who take the findings of an evaluation report but actually do nothing about it, because their implicit purpose was to just have a checkbox, evaluation's done, project is over, I've got my accountability, and I'm done with this. We also need to look at, as in terms of knowledge, that who is this knowledge for? And so the holder of that knowledge is the creator of that knowledge. And so here we go back to from the persons and the people from whom we have, collected our data, because we often forget that when it comes to the findings that we need to share it. And how do we share it? Then, of course, we have questions around that. And in this particular, I really like this particular principle because it's something that Anjali was talking about, that the evaluation experience itself affects people. And it affects people in many ways, not always positively. And I think as evaluators who want to use feminist evaluation approaches have to be very cognizant of it. So the whole question of tightening the questionnaires, or the women not being able to recall, it's not easy to talk about trauma, and any sort of violence we discuss, it's going to be difficult. And the last one is about knowing, that there are multiple ways of knowing. That's the last principle of feminist evaluation, and that some are more privileged than others. So here we talked about, that policymakers want numbers, so we give them numbers, and how do we convey the findings to, say, a non-literate audience? So we talk about multiple ways of knowing, but what I wanted to particularly emphasize here is that we often do not give enough credence to the lived realities of women. We are so caught up in our outputs and activities. What is that lived reality of women? Why do we relegate it to a case study? Why cannot we use, as some of us said, to use these qualitative methods, convert them in a process where you can have it, say, more quantitatively or more palatable to policymakers? But why should we ignore the lived realities of women and not put it center stage in the evaluations that we do? So this brings me briefly to a discussion on measurement. So, of course, we have to evaluate our objectives because that's what we are expected to do, that's what the money has come in for. But I would say that if we are using a feminist lens or an equity-based lens, we are going to ask ourselves, did these objectives ultimately make a difference? You may have got your outputs, you may have got your outcomes, but there may have been little difference. And that takes us back to the structural and systemic, the various complexities that are present whenever we talk about gender and violence. So we not only ask whether we have made a difference, say, in the lives of women, but we need to go one step further and ask, who did they privilege? Because in any project you do, there will be some women who will be privileged, even the most marginalized, and there will be some who will not. And so that feminist lens needs to reach out to those who have not been reached at all. And what are the changes in the power differentials that have taken place? And we've heard that from all of our speakers. We've also heard about what we value, we measure. Right? So if we take a certain stance in ideology, what we value, we are going to measure that. But it's very important because what we measure is what we report. And what we report is going to influence that discourse and the policies. So in a sense, taking a stand is actually useful when we are talking about gender and violence. We especially want to ensure that the voices of the excluded are heard. And so we want to measure agency at the individual level, as some have questioned, about their aspirations and their self-confidence and so on. But we also want to measure the structures, the community norms, whatever the policies and so on, which are conditioning the choices. They influence the choices that are being made. And so we need to look at the local governance and the justice systems that was talked about in the projects. And we also want to talk about the relationships, because ultimately it also is at an individual level. So the power relationships that exist, they ultimately will always have to be negotiated. So no road to empowerment goes without any negotiation. So we need to address that as well in our measurements. I'd like to just say that of all that we've talked about measurement of change and how important it is and how we can do it and what methods and tools and so on, it's absolutely useless if we cannot use it, if we cannot use what we have learned or what we have found. We can say that, use happens, but we know it doesn't. It doesn't happen automatically. And for us, dissemination is a byword for use. So we say, fine, we've disseminated the findings, we invite people and we talk about it and we assume that somehow miraculously it's going to find its way into policies and programs and changes in interventions. So I think we need to be a little bit serious about when we are taking all of these efforts and trying to bring these voices up to the mainstream discourse, to pay a little more attention on what is use. And there is a very good framework for that, which has been developed by Michael Patton. It's called the Utilization Focused Evaluation. And he talks about 12 steps on how to go about it. In his latest book, he's expanded to 17, but I like the 12 steps. And what he does say is that right from the start, not at the end, right from the start, you need to identify who are your users and what are they going to use these findings for. What are those key questions that we need to address? And that is involving the user, the users, and the key questions right at the start of your evaluation design and not at the end as an afterthought. And overlaying the use-based evaluation over the feminist lens provides us an opportunity to influence the wider social discourse, which is what we ultimately do want to do. I'd just like to also talk about, because it's something that really is something so critical, is another idea that has been floated by a development economist called Sudhir Anand, and he calls it the cost of inaction. So what is that cost of inaction? If you don't provide services to women when they walk in faced by violence, if you don't provide services at that very delicate time where the adolescent girl is about to move out for migration or for jobs or for whatever, what is that cost of that inaction? Is something I think is we can add to the feminist lens that we are discussing. Because the negative consequences that will happen because of that inaction is something that we are never going to be able to revert. And so it should influence what we do. I'd just like to end by saying that the sharing of knowledge that has happened over here, generated through evaluations, through the various experiences and examples provided by our presenters, is one step towards influencing the discourse amongst us, and hopefully it would be able to snowball into other areas of influence. And I think it provides us an opportunity to reflect very deeply on what we do, and especially to think about if there are so many frameworks out there which are used, say the impact evaluations or other frameworks that are being used. Why is it that we cannot also promote a more engendered framework for evaluation? And I think all of us can, in our work and in our discourse, contribute to that. Thank you.
Thanks, Sonal, for summarizing it so beautifully. We can have 3-4 questions now because it's a general question and answer session. So,
Sonal, that was lovely. I am actually a fish out of water over here because my background just now is I function as a mental health professional. But what strikes me is that an evaluator's self-perception is that she's an evaluator. But the person being evaluated, when it's a victim of violence and trauma, it's pretty possible that you cannot have a compartmentalization. The evaluation process needs to include a certain sensitivity, a certain empathy, a certain understanding of what trauma does to people. So we are not just focusing on question and answers, but we are focusing on the person primarily. I mean, I think that's all that I want to say. It's not just about collecting data, it's about seeing how do we change lives of people who've gone through things which we need to have a deeper understanding of.
So my name's Havuvi. I'm actually thinking about how we write up what we find. And I'm with the feeling that we also have to be a little bit humble about how we write, because not everything changes every time we do an intervention. And this is especially true when we write up case stories and things like that, because there's a tendency to want to put everything into that case story and make it out to be the model of something. But the real person's life was not that, and the real person's experience was not that. And I also think that, there's a certain responsibility we have as people who believe in a certain kind of approach to gender and understanding of gender. There's a certain kind of responsibility that we have to write about the small things that happen and to make sure that people understand that the small things are big things. Otherwise, all of us are trying to get to that big thing at the end, and the real change is getting missed out on, and we're also doing a huge disservice to the larger debate on gender equity. So I've just been thinking about that, so I thought I'll share it.
We'll take one more question, and then we'll open it up to our panel.
Can I sort of, even though I'm sitting on this side of the table, can I ask a question going that side? Just very quickly, and this more coming from the program side. Sorry if I'm sounding very drab at this moment, because we've had such wonderful, thinking, sharing, collective reflection. So two things that come to my mind is that I don't know how much others are battling with it, but, particularly Anjali, when I was hearing your presentation, I know that, there are times when a program has been implemented, so to say, sorry for using these very cold words, and then when it started, there was no thinking on the evaluation, maybe no thinking even on really a careful monitoring the 30 years back that we were talking about. But then you kind of start doing an evaluation which is more in hindsight, if I may want to use that word. So the program, it's been implemented, it's ongoing, and then we say that, okay, now we want to evaluate it. And then the big challenge of attributability, because you may have started with A, B, C, but, listening to Anjali's presentation, that we hear that, beyond the A, B, C, D, E, F, G, H, I till Z also happen in the program. So this whole thing of attributability that come to, people who are working from that side of whatever we want to call program implementation, or, just the whole, ending violence against women. So that was one of my questions. And the other was, very quickly I find that with our experience that, especially on violence, that many times the negotiations for me as an individual might be very difficult, but for me as part of the collective are so much more easy. So in terms of, even capturing data, so what are the tools that we want to use? Is it always one-on-one interviews or focus group discussions, or like Anjali, of course, responded to somebody saying that it depends and you could have both. But I do find that on especially issues of violence, yes, maybe collectively women may be able to voice much more than individually. Yeah. And again, that's all the feminist thing that we have been discussing, so just another aspect of that.
Shall we stop here and ask our panel to respond to these questions before we move further?
I'd like to, although they were not specifically focused, would you like to respond first? Go ahead. Okay. I think that, there was an individual who asked about the fact at the back that evaluations per se, the very act of questioning around an experience about a lived reality that might be painful, creates a lot of trauma for the individual. And I think the question was, what I heard was maybe this kind of sense of being extractive about data, and not so much really about the compassion or the sensitivity to the context. And I would say really a good evaluation should recognize and not be complacent about the
experience in the context of what you're doing. And in fact, in the area of gender-based violence, there's been decades of research, and WHO, Mary Ellsberg, Laurie Heisey, they've created a framework about how do you really even engage or begin to collect data on these issues, and it should not be done in a trivial manner. The kind of ethics and around the collection of data are very, very important. The kind of training of your investigators, the counseling and the support you provide, not just for the women, but also for your investigators when you're exploring the issues of violence, because when you really kind of raise that level of pain or experience that women have gone through, it's also very fatiguing and emotional for investigators, and there's a lot of investigator fatigue around these issues. So I think we've learned a lot around the area of violence research, and anybody who's getting into any of these areas which are deeply sensitive, whether it's child sexual abuse, violence, whatever it might be, or it might be some other sensitivity, caste issues in another context, I think there are ways of really being very ethical and responsible, and often we kind of trivialize this, the whole process of what an informed consent form should be. We just trivialize that process, but what really is an informed consent, how do you read it, what should be in it, how do you train your investigators to read it, how seriously you take it in terms of your quality assurance for research. These are very important issues. So I wanted to emphasize that. I'm sure others will emphasize other pieces of it. And I do think that sometimes one of the things that you said, what I also felt was that, you know, sometimes I feel like in every project, everybody feels a need to collect the same data. So for example, do we need more data on prevalence of violence? Do we really need that? Because there's been the multi-country studies, there's the NFHS, there are other studies. So in fact, I think the sensitivity would come in that if you're really going to go deeper into the space of women's lived experiences of violence, do we need a lot of quantitative data with a large sample size to calculate prevalence against, or other things additional that we don't know that we can add and contribute to data? So you're not causing a lot of, I mean, you're not really causing lots of women to go through a lot of this experience to just create another point estimate that might be important for your study or your publication. I think those are questions that we have to ask ourselves as evaluators. I also want to say that many of us are not evaluators. Like I'm a social science researcher and I do evaluations. So a lot of the work we do, we are not really coming into this as an evaluator, and I don't know what a strict attribute of an evaluator is, but I think many of us are trying to understand how social change is taking place and how women's lives are taking place, at least the space where I'm coming in. And sometimes an evaluation is just the lens or the space that you're exploring to really understand that, and that's much more often there's a demand for data in an evaluative context, and that's how it's happening. The other thing I also wanted to say is the point what you stated about not all change is positive or linear and how should we responsibly talk about it. I think you stated what we were also trying to say, that don't only report the positive. There's even the context of failure or the things that did not change or the negative implications should be talked about and reflected upon as much as the positive, because the idea is not only to say the program was successful. And I think therefore sometimes the kind of evaluations that we are doing, nobody's asking us to do it. We are trying to get into a particular space to really understand, and I think that's really useful because there's no stakes, there's no vested interest to prove this or that. And the last thing is about the question around when a program started. When the program started, we didn't have the frame of evaluation, and 20 years later we are going back and trying to explore this. And really is this, I mean, can we really talk about attribution? We're doing this study, we're doing an evaluation of a conditional cash transfer program that existed between 94 and 98. And we decided to evaluate it in 2010. And it's been a very challenging experience because we know that a lot has changed in the context in the state of Haryana in 18 years of girls' lives. So for us, the issue is even how much ever methodologically rigorous the evaluation is, which it is, we'll never can quite say that there were no environmental or structural factors. In fact, for us, the idea is to really capture what are the policies changed, what are the new programs of the government came, how many schools emerged in the social context that we are researching in, because we're looking at girls' education and marriage. All of that is equally important, and not just important to get data from the girls and look at how the outcome has changed. So.
Okay. Just I mean, I think some additions rather than any new thoughts. I mean, I didn't get into the details of the study further to say that, well, one is, of course, that we were in the School of Social Work. So social work has its own practice, ethics, a whole lot of, what do you call, understanding of over the years and work. So in that sense, we were working within that frame. So that would definitely only be added by a feminist lens. So in terms of its ethics of how, when you go back to the woman, or how do you, talk to her, or who should be talking to her, and all those kind of thoughts did come in. There were, when I say consultants, investigators, research officers, I use words like this, but they were all trained social workers themselves who were interviewing them, who knew what they had to do, who had worked before. So there was a whole lot of things that were taken care of in that particular, within that frame, is what I'm definitely saying. And definitely one wants to know the impact of the work that has happened, and that this interaction also would have an impact, and therefore what all would it mean to be taken care of. So yes, that's what we did keep in mind. Because we were more concerned about what we do with violated women than, because it's that we can have more programs for violated women, we needed to take care of both, indefinitely. Okay. Talking about the, trying to respond to what you were saying, Anju, in terms of, if I were to look back and look at the broad objectives that we wrote in 30 years back, and then when we developed this monitoring indicators, I see that it was essentially unpacking those broad objectives, rather than not having touched that at all. One thing which happened in the mid of the research, not this evaluation study, but another research study, we suddenly discovered that what we were doing as an objective of this special cell was to rebuilding women's, dignity, self-worth, and self-confidence. And while we were doing that, first to build that and then work with the women, was not articulated in the objective at all. So there are those kind of things that while you're doing but have not articulated it, are the kind of things also that happen over the years. And I think it's also because of today's environment, today's climate, which needs everything to be articulated, stated, presented, projected, never mind many more things. And which is not to say that it's, but which was not the environment or the climate when one began this work literally in history. So if you think it that term, today all this is required, because you're saying then what do you attribute it to, what is it, how is it? So you're asking us a lot of questions which were a lot of assumptions at that time. Yeah. So, and the minute you start asking the question, I am able to respond to them, I am able to produce data for you, and so on. So I think, yes, today it's much more, and today many more people are, as you said, there are many more funders, there are many, the profile of the funder is changing, the people who wanting data is different, which was not the case again as earlier. So I think because of these shifts and change also, we need to keep that. But I do feel that broad objectives still are able to carry you through, and then it's your actual work which then starts getting, stated. The second part, which I think is the documentation. So when we did have registers. It was not that just because women came and we didn't have registers. We had files. We had a whole lot of systems that grew on us, which was not from the day one that worked with it, because this was a new service. So and yet social work was not new. So this kind of combinations, and I do remember I was one of the first workers, and I had a journalist come and ask me that, am I a feminist? And I said, I haven't read enough to know if I'm a feminist. As soon as I kind of comprehend, develop, read, I would be able to say. But on the first year in '84, I didn't know if I was a feminist. Now today, I am able to say it with all these kind of thinking, feminist evaluations, feminist thought, feminist frameworks, feminist. There's a whole new evolution that has taken place. And yet, in the police world, we talk about it as pro-woman. I don't say it is a feminist because you know that there are other kind of reactions to it. So I think these are also people in the program, in the practice space, which have to deal with multiple aspects of doing a service, doing an evaluation, and it doesn't remain just the evaluation, because you have too many stakeholders that you need to take care of. I mean, to consider, not take care of, consider before you are able to make a statement. So this evaluation is one part of that scare which we talked about, is what does it do to you as evaluators? What is that? What will it therefore do to the service or to the program? And all this kind of promises that we make to the larger group or society or community or that you are addressing.
Okay, thank you very much. I think that's all the time we have for questions, but hopefully we can continue these conversations over tea. So I would first like to thank our panelists for taking the time to speak with us this afternoon. I think we got a lot of very interesting insights on their research and the different issues that surround research and evaluation and gender. So just a few reminders. If you could fill in your feedback forms before leaving, that would be wonderful. So if you can just drop them off with our colleagues in the back. Additionally, if you're interested in joining or registering with the community of evaluators, there's also an opportunity at the registration table in the back. But please stay. There's tea and snacks and all that, and we can continue these conversations. Thank you.
I missed yours, but